Hello everyone. Today, we're diving into the world of a medication called Sumatriptan, commonly known by its brand name, Imitrex. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Sumatriptan, known by its brand name Imitrex, is a medication primarily used to treat migraine headaches once they have started. It belongs to a class of drugs called triptans, which work by narrowing blood vessels around the brain and reducing substances in the body that can trigger headache pain, nausea, sensitivity to light and sound, and other migraine symptoms. Sumatriptan is available in several forms, including oral tablets, nasal sprays, and injections. Approved by the FDA in 1992, it's one of the most commonly prescribed treatments for migraines. Warnings: Sumatriptan comes with several precautions. It's not intended for individuals with certain cardiovascular conditions, including ischemic heart disease, history of heart attack, stroke, transient ischemic attack, TIA, or severe hypertension. The medication can cause serious cardiovascular side effects, including heart attack or stroke. Those with a history of hemiplegic or basilar migraine should also avoid using Sumatriptan. Additionally, Sumatriptan should not be used within 24 hours of another triptan medication or an ergotamine-containing drug, as this can increase the risk of serious side effects. It's crucial to inform your healthcare provider about all medications and supplements you're taking to avoid potential drug interactions. Before taking this medicine. Before starting Sumatriptan, several factors need consideration. Inform your healthcare provider if you're allergic to the drug or any of its components. If you have a history of cardiovascular issues, liver problems, or severe kidney disease, it's important to discuss these with your doctor. Those with a history of seizures or conditions that predispose them to seizures should also exercise caution. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider before taking Sumatriptan. The safety of Sumatriptan during pregnancy has not been fully established, and it should be used only if clearly needed. Side effects: all medications can have side effects, and Sumatriptan is no exception. Common side effects include dizziness, drowsiness, feeling of warmth or tingling, pressure or heavy feeling in any part of your body, particularly in the chest or throat. These effects are usually temporary and resolve on their own. Serious side effects include chest pain, irregular heartbeat, shortness of breath, and sudden numbness or weakness, especially on one side of the body. Other severe side effects can include severe stomach pain, bloody diarrhea, high blood pressure, or seizures. If you experience any of these symptoms, seek medical attention immediately. Rarely, Sumatriptan can cause a condition known as serotonin syndrome, especially when taken with certain other medications. Symptoms of serotonin syndrome include hallucinations, fast heart rate, loss of coordination, severe dizziness, severe nausea, vomiting, or diarrhea, and twitching muscles. If you experience any of these symptoms, get medical help right away. Interactions: Sumatriptan can interact with other medications, including antidepressants, MAO inhibitors, and other migraine medications. It's essential to inform your doctor about all the medications, supplements, and herbal products you're taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Sumatriptan. The typical starting dose for adults is a 25 mg, 50 mg, or 100 mg tablet taken at the onset of a migraine. If the migraine persists or returns after relief, a second dose may be taken after 2 hours, but the total dose should not exceed 200 mg in 24 hours. For the nasal spray, the usual dose is 1 spray, 5 mg or 20 mg, in one nostril. A second dose can be administered at least 2 hours after the first if needed, but not more than 40 mg in 24 hours. For the injection form, the usual dose is 6 mg injected just under the skin at the onset of a migraine. A second dose can be administered at least 1 hour after the first if needed, but not more than 12 mg in 24 hours. Avoid: while on Sumatriptan, it's advisable to avoid activities that require full alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Avoid alcohol, as it can exacerbate certain side effects. It's also important to avoid using other migraine medications within 24 hours of taking Sumatriptan. FAQ: Many wonder about the age restrictions for Sumatriptan. Currently, the safety and effectiveness of Sumatriptan in individuals younger than 18 years of age are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Sumatriptan. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.